But right now we're going to start out with Dr. Jian Chen, and he is originally from China, and he is a robotic spine surgeon, and as I mentioned, there's only 30 in the country, and he has 2 of them. How do you rate to get 2?
Good morning, everyone. I first wish everybody a nice holiday season, a wonderful new year. Anne says it. I'm a spine surgeon, and my specialty is minimally invasive surgery.
Minimal invasive, which is really good.
Yeah, it has been proven to really reduce the complication rate significantly, get patients back to on their feet very quickly, quicker recovery, and really and much smaller incisions. So we really offer a full spectrum of minimally invasive spine surgery.
And this is at St. Mary's in Tour?
Yeah,
okay.
I work at both hospitals.
Okay.
And I'm proud and very confident to say the quality and the result of our minimally invasive spine surgery are really top-notch in the world.
Now you brought some photos.
Yes.
Do the photos show what it looks like?
It does. And today we're going to focus on the robotic spine surgery, which is very new technology. And so far we are the only centers in the Northeast to have this technology. Harvard doesn't have it.
Harvard doesn't.
There's none in New York City.
Wow.
Luckily we have 2 robots. It is a special technology that let me target the spine pathology and do spine instrumentation in a very precise way. And it is all done percutaneously with very small incision. The accuracy of this robot can be less than 0.5 millimeters. It's really a step forward in the area of spinal instrumentation.
Do they do fusion with this?
Yes, we
can do a fusion with
we
that.
use this for fusions for most times. We started this mid-July, and so far we have done about 40 cases, and I'm very happy to say every one of them we have great success.
Is everyone who is a candidate for back surgery, are they all able to do? Are you able to use this type of procedure on those, or is this only for special cases?
This is only for certain cases, not for everybody. And as a matter of fact, majority of patients who have back problem, neck problem, they don't even need surgery.
And that's what they say.
Yeah,
years ago it was surgery for everything. Yeah.
Right. We really carefully select patient and make sure it is the right surgery for the right patient. Mm-hmm. That's the key for spine surgery to have great success. You really have to look at each patient individually and offer them different surgery. But we are very fortunate that we use minimally invasive spine surgery for every patient who needs surgery.
Now, what does robotics mean then? Is it use the camera, or how do you?
The robotic is before the surgery, we do a CT scan of patient's spine, and then from using special software, and out of that CT scan, I plan the spine surgery, and then I send these all file and put into the control for the robot, and the control sends signal to the robot during the surgery and tell me exactly where to put the spinal instrumentation.
Oh, because it's measuring the whole time.
It's measuring the whole time, yeah.
That's incredible. Where was this developed?
It was developed in Israel.
Okay. Mazur, it's called, right? Mazur?
Yes.
Yeah.
Yeah, that's the name of the company.
Renaissance.
Yeah.
Mazur Renaissance.
Mazur Renaissance. Yeah.
It's an incredible. We're going to see more and more of this, don't you think?
Yes.
With surgery.
Yes. We will see more and more of it because it is exciting new technology, and he has has been gradually proven really superior to freehand surgery.
Yeah. You still need the surgeon there. You can't just turn
Yes.
it on and walk away, can you?
No,
Get a cup of coffee or anything.
I can't. Yeah.
Do you foresee this expanding into other areas like abdominal surgery or brain surgery or anything like that?
I do. As a matter of fact, in the area of urology, the prostate surgery, they have been using robot called Da Vinci. It's a different
The Da Vinci,
robot.
yeah.
Yeah, and in the total joint replacement, there is a robot called Mako for joint replacement, like knee replacement, hip replacement. And I know a couple companies in the development for cranial surgery, which is a brain surgery, with robot.
Incredible. The thing that I was so glad when Ed Parham suggested that you come on the show to talk about this, because we have this in our area. I mean, I can drive 15 miles and get this outstanding surgery. They don't even have it at Albany Med, do they?
No.
Can we mention that?
Yeah, as a matter of fact, we are the only center, actually 2 hospitals, same areas in Nissan Latour. They each
That's
have
because
one.
of you.
We are the only one north of Pennsylvania in the whole North America who have this technology. Yeah.
Now, you mentioned that there's a faster recovery time on this. Are people in and out of the hospital within 48 hours?
As a matter of fact, overnight.
Overnight?
Yes.
For spine surgery?
Yes.
Oh, my.
For minimally invasive spine surgery, about half of my patients who do not need fusion, that I do endoscopic surgery, other minimally invasive spine surgery, they actually go home from the recovery room. For patients who need a spinal fusion, that we most times use the robot, they stay in the hospital overnight.
I had a spinal fusion many years ago, and I was there a week. It was like, oh my God, this sounds wonderful. You had to lay flat on your back. You couldn't move. It was like really.
Right. Our patient actually get to walk after big spinal fusion surgery the same day.
That's wonderful.
They stay in the hospital overnight, and a patient always asks me, when can I drive? Actually, most of the patient can start driving in a couple of days.
Oh my heavens. Yeah. Where were you when I needed you? But that's really, we brought Dr. Jian Chen on to talk about this wonderful. We are so fortunate in our area. I mean, this is an incredible thing to have in our area, robotic surgery for the spine. And you can probably find him over at the hospital and at either Nathan Latour or St. Mary's. And find out more about it. I know if you go on the web, you can certainly see him. Just put his name in and you'll find out all about him, his background and everything. So, Dr. Chen, I want to wish you a very happy holiday. And thank you so much for being with us today.
Happy holidays to you.
Really wonderful. And thanks, Ed, for bringing him. That's great. We're going to take a quick break.